Good to see everyone. What a great day it is today. Beautiful outside, sunny.
I agree.
I'm excited to be back. Our last show before summer break and summer, a little bit of R&R or a change of pace for most of us that way. And most of us are still probably going to keep working, but we're going to take a pause from the RDH view through the summer. And today we've got an awesome show planned for you as per usual. And I'm excited to get started. I think we're just getting things set up on Facebook right now, right, Beth? Are we good to go?
We're good to go.
Awesome.
And I just did a little post, so we're all good.
Wonderful. Wow, we've got a great attendance already. This is so exciting. Yay, welcome back, everybody.
Welcome back.
So Kath, why don't you start off with the introductions? We might as well get going right away. So we're keeping everyone's time.
Is there any housekeeping or there's no housekeeping? We're all good?
Let me just give a couple of quick instructions here, just making sure Facebook's up and running, which it is. So we have lots of people joining us today. I'm very excited about that. We have a full, we have a full program today. It's going to be live, interactive, and fun. So with lots of people here, we do our best to get to questions. So if you do have a question, please use that Q&A icon at the bottom of your screen and type your questions in, and we will do our very best to get to those questions. We can't see you, so don't worry about that. No one's visible other than the panelists here, so make yourself comfortable. And yeah, enjoy. We're just very excited to be here.
Thank you. And I'll just add that for those of you who would like a CE certificate, if you registered on Zoom, you will have access to the CE certificate. We'll upload it into your personal portal. We'll take all the CE or all the registrants, put it into the portal. There'll be a short, true and false quiz that you'll answer, and then you'll get your certificate. And for those of you who are just joining us on Facebook, what you could do is just email us at info@rdhu.ca. So it's info@rdhu.ca. And just say, I just attended the live RDH view, and could you please connect me with my certificate? And then we'll create a personal portal for you as well. Okay. All right, so we have a mystery guest today, which is going to be very exciting, a surprise for Kristen as well. So that, you'll find out why we've asked this lovely dental hygienist to come on with us. But before we get started, I just thought I would read a little brief bio on Kristen, the lovely Dr. Kristin Yont. So Kristen was born and raised on a farm in Saskatchewan and graduated from the University of Saskatchewan College of Dentistry as a general dentist in 1998. She has spent her entire career practicing dentistry in downtown Calgary. She is passionate about her profession and wants to make a difference in the lives of the people she serves. For more than 2 decades, she has worn a few hats as a dentist and co-owner of Downtown Dental. So sports dentist working as part of the medical team for the Calgary Flames. How cool is that? She is currently the lead dentist. Woohoo! A forensic dentist, which is really cool, working with the Chief Medical Office in Calgary. And most recently, she has completed a mind-body medicine program through Harvard Medical School and the Benson Henry Institute. She is now accredited to teach their SMART program, which we're going to talk about today, which educates patients to participate in their own wellness to decrease stress and their vulnerability to disease. And I took part in Kristen's 8-week program in the fall, so I'm excited to share that with all of you today. Developing human connection is of the utmost importance to Kristen. She enjoys helping patients participate in their own well-being. She's also been a certified yoga instructor for over 10 years. She teaches yoga, teaches yoga teachers and students anatomy, physiology, and the neuroscience of meditation. In addition, she leads students through guided meditations. She enjoys spending time outdoors, running, cross-country skiing, and mountain biking, and she loves to cook for her husband, Darren. So with that, I'd like to welcome you, Dr. Kristin Yont. Kristen, thank you so much for being our guest here today. We're really excited to have you. And I'd like to have a special or acknowledge Crescent Roll for arranging this and for sponsoring this session. So with all that, let's talk about stress and our stress response, Kristen. And we all have it, but what is it really?
Thanks, Kathleen. Honestly, thank you. And it's so awesome to be here. Well, before we get into stress, I want to just talk a little bit about kind of some brain facts. Every single organism on this planet has a mechanism to manage our stressful situations. And humans, we're so highly intelligent. We have such high order and intricate connections to deal with our stress. It's taken our brain 4.6 billion years for it to get to this point. We have like 100 trillion connections within our brain, and we're just so highly intelligent. But here's a couple things to know, brain facts, is you lose what you don't use, right? If you don't use those connections, you lose them, right? But on the other sense, you can always reconnect the connections and you gain the brain that you want to use, right? You can always grow the brain that you want to use. And so an example is if you learn to play the piano when you're a kid, right? To play the piano maybe till you're 10 years old, then you stopped. Well, the brain doesn't want to keep those neurological connections handy. So what the brain does is it kind of prunes them back or shears them back. And so maybe a couple years, maybe 30 years later, if you go back to wanting to play the piano, well, you think, oh, jeepers, I haven't played the piano since I was 10. Well, then you start playing the piano again. Our brain has the ability to reconnect those connections. And that's just neuroplasticity of our brain. So remember, we're going to grow the brain that we want to use. And we have the ability to do that, which is really so exciting. Mm-hmm. I'm going to talk a little bit about, brain evolution 101. Because it's taken so long for our brains, like our human brains as Homo sapiens sapiens, right, to develop 4.6 billion years. I'm going to talk about different areas of our brain and how our brain has grown a little bit over that period of time. And if I talk through the program about, our primitive brain or our ancestral brain or our reptilian brain, really that's the part of the brain. This is our brainstem. And that is the area that deals with our survival. All creatures have this aspect, the survival aspect part of their brain because it's there. It's operational for special functions like breathing, managing our blood pressure, our hunger, our thirst, heat regulation, sexual function. That's all survival type of functioning that we have. Now, we'll also talk about kind of another layer onto the brain that came a little bit later in evolution, which is where we talk about our limbic system. Our limbic system basically processes and manages our emotions. We call it our emotional center. This is where we deal with certain things like lust and petulance and rage and fear, which we'll talk about, and threats. Reptiles aren't really known for their emotional sense, right? So they have a brainstem, maybe a little bit of limbic system, but we get into different creatures which have more of an evolved limbic or an emotional center. Then we get where we're talking about the newest part of our brain, right? Our cerebral cortex. And this cerebral cortex is what makes our brain so big and why our head expanded over the last 200,000 years with the growth that it did, because it just contains so much integrative functioning and processing. And mammals have it, but humans, we just have such large integrated intelligent brains. I want to focus a little bit on this part of our brain, right behind our eyes. It's the newest part of our cerebral cortex, which is called our prefrontal cortex. Our prefrontal cortex, humans, it's allowed us, the development of it has really allowed us to be able to survive. We're not as strong as a saber-toothed tiger or a bear, but we've been able to outsmart them so we can procreate our DNA and survive to this point and live these awesome lives that we live. You know, what do our prefrontal cortex do? Like, what does it do? You know, it manages our cognitive functioning, right? Rational thinking, memory, learning, insight, flexible thinking, emotional regulation, you know, all the stuff that we need from our higher centers to be able to live in the world that we live in today. Now, particularly as we talk about stress and stress management, we need a high functioning prefrontal cortex to be able to mitigate our stress response. We've got so many stressors coming at us all the time. We need this prefrontal cortex and the connections that it has to the lower areas of our brain to be healthy and functioning. We can look at our prefrontal cortex as like our wise elder, right? The elder that says, no, you know what? You can manage this stress, and it helps dysregulate or calm down that part of our fear response system. All right, so let's get into talking about stress. You know, what is stress? We all know it, we all have it. It's basically, you know, any demand that's throws our physiology out of balance, right? We talk about homeostasis. Our bodies always, we have all these connections in our body that we're always trying to balance ourselves. What would a stressor look like today? Maybe stepping off a curb, almost getting hit by a bus, being late for work and having to get stuck in a traffic jam, or even just waking up in the morning can really be a stressor to our system. And so then what is our stress response? Well, it's the body's response to any demands or challenges that are put on it. And our stress response is a normal response. It deals with challenges, it deals with threats. And our brain is constantly wired to be dealing with threats, right? Looking out for threats. We've got this part in the limbic system, which is called our amygdala. And the amygdala acts as a radar, you know, kind of like at the airport, where it's constantly scanning the environment for threat. When threat is detected, well, then it triggers these lower brain centers, right? That survival part of the brain, which I just talked about. And it activates our sympathetic nervous system, right? The fight or flight system, activates our hormone system, you know, the HPA axis. But then it also activates our immune system, which we're going to talk about. Now, threats come in all forms, right? Normally, our stress response is designed to keep our DNA safe, allow us to survive and procreate, right? But primitively, threats back in the day came in the form of acute physical stressors, right? Encounter with the saber-toothed tiger, you know, run into a grizzly bear in the woods, getting stalked by a cougar, maybe getting disemboweled by a lion, right? We need these systems to fire off very quickly to be able to allow us to get away from these situations. However, presently, threats don't so often come in the form of acute physical crisis, but they come in the form now in our modern world as perceived psychological crisis. And they come in the form, most of the time, of thinking about a 25-year mortgage, thinking about climate change, inflation, mortgage rates increasing, fast-spreading viruses that lock us up, you know, reading fake news on social media. These are all psychological stressors that we get hit with all day long. And, you know, no matter what the stressor is, whether it's physiologic or psychologic, the same stress response is released within our body. You know, we have the same neurotransmitters that are released, the same hormones that are released, because our body is designed to attempt to rebalance our system. You know, what if I said to you right now, I want all of you to just go up on the stage. There's 500 people out there in the audience, and I want you to solve a complex math problem. Think about what would happen, right? I know what would happen to me. I don't even like math, but think about what would happen inside of you. You know, adrenaline would be released, right? You'd increase your heart rate, increase your breathing, increase your blood pressure, might feel a little muscle tension, right? Maybe your palms start to sweat, mouth gets dry, right? Maybe hands start to shake a little bit as circulation or blood flow is, you know, sent to other areas. Maybe you just got to go to the bathroom 15 times before you get up there, right? There's parts of the stress response, if you're standing up on stage, you wouldn't know what's happening. Well, it's the hormone cortisol, right? We talk about this, we hear about it. Cortisol is good. It manages our metabolic needs, right? Because when we're running away from a bear or up on a stage, we need energy to be able to manage what's going on. However, you don't know that it's there. And if we have an excess amount of cortisol, it can be detrimental to the body and to the brain. Some of the other things you wouldn't recognize if you're on stage and a little bit stressed out is you have a decrease in digestion, right? The body doesn't need to digest that bagel right now. Your cellular growth is inhibited. Grow antlers later. Tissue repair down. Why do you need to repair a wound if you're about to get hit with a stressor? Maybe you're not going to make it for the next 15 minutes and your sexual function goes down, right? Ovulate another time.
That is very fascinating, honestly, especially, from being in hygiene. Like I think of all those things, but the tissue response, that's something that I never really would have truly paired. And that's so fascinating because it is so important, I truly think, to understand the importance of stress and how it influences our clients' oral hygiene and their oral health. So can you give us a bit more tidbit? Like, I want you to unpack that box big time because I think you've got all of our attention. So please share some more wisdom, honestly.
Well, like I said, the stress response is completely a normal response, right? And it's evolved to deal with this acute physical crisis. Crisis happens, the body responds, crisis averted, and the body physiology goes back to normal, right? And it's kind of like an inverted U shape. It happens, goes on, and gets better. However, when these acute stressors that we have, psychological or physiologic, when they become chronic, like managing maybe a sick parent, losing a job, going through a divorce, our stress response doesn't turn off. This is what makes us sick, right? This is what increases our vulnerability to disease. Chronic stress is an inflammatory disease. And we know that because it creates an overproduction of inflammation within the body, because it upregulates part of our immune system, which throws off inflammatory mediators. It's also clear that stress can get translated into metabolic activation. And it's through a process called oxidative stress, because when we're in stress, we have high metabolic needs. We need more glucose to run away from the bear. We need more oxygen to be able to do that. And what happens is when we are constantly processing the oxygen or the glucose, we have byproducts that are given off, and that's what's called cellular oxidative stress. It's kind of like if you step on the pedal to make your car go faster, there's more emissions that are released, right? Same thing with us. You step on the pedal, you need more energy for a long period of time to deal with chronic stressors. Well, what happens is we have these, through oxidative stress, we have these emissions, these toxins that are released. And unfortunately, toxin is very difficult for the body and very difficult for the brain. We know these inflammatory mediators, they cross the blood-brain barrier. And when it does that, it causes a neuroinflammation and it dysregulates the important connections of our brain. So remember we talked about that prefrontal cortex, and it has to be able to talk to the lower centers of our brain, our emotional centers, and our brainstem. Well, this is really important because when we have the cellular oxidative stress, these toxins, this neuroinflammation, this inflammatory process going back to the brain, it cuts down and it prunes out those connections. So this very important executive functioning part of our brain can't be the elder and talk wisely to our stress system. And that's really important. And, as an aside, it's also important to know that stress, it has an influence on our genes that have to do with aging, have to do with inflammation, has to do with insulin regulation and cellular function. But if we look at kind of, how does this all relate to us as a dentist, as a hygienist? How does this relate to our health and well-being? How can we help our clients? It's important to know that, stress and the lack of resilience to it are major drivers of illness and decreases the quality of life. If we have poor psychological and physiologic resilience to stress, it drives a great deal of healthcare utilization in this country. And 90% of people suffering from stress-related illness, what do? They see their healthcare practitioner, their primary care practitioners in their doctor. Well, stress-related issues can comprise as much as 60 to 90% of a physician's caseload throughout the day. What's the physician seeing? What are they managing? Common physical manifestations of stress are things like headache, back pain, neck pain, insomnia, irritable bowel syndrome, GERD, anxiety, hypertension, brain fog, decreased memory and concentration, right? Weight gain. But from a dental perspective, you know, as a dentist in my office, from a hygienist perspective, what do we see in our patients? Maybe they'll come in with muscle tension, head and neck tension. You're doing your head and neck exam. You're feeling sternocleidomastoid as like tight as steel cables, right? Maybe that's just from stress of hiking up their shoulders in this survival response, or maybe it's from being on a computer all day. We can pick that up in our clients. We see bruxing, right? And the wear facets and the fractions and the recession and the hypersensitive teeth. We can see jaw pain, TMJ pain, clicking, popping, you know, disc dysfunction. We can also pick up headaches and migraines. Now, when it comes to periodontal disease, which is an inflammatory disease, we know that stress affects our immune system, which also affects our gums, right? And it decreases our ability to manage plaque. It increases our reactivity. You know, say we have a little bit of plaque, you know, you look in someone's mouth and maybe their gums are bleeding, but yet they're brushing and they're flossing, but they're still bleeding and there's not a lot of plaque. Well, maybe stress is incorporating in that because it's decreasing the immune system there. You know, so what do we have to do as dental professionals? You know, let's just tell them we got to get them into a, you know, an Oral-B IO electric toothbrush, right? Get them the proper toothpaste, the stannous fluoride, the proper floss, maybe the proper mouth rinse, right? And so it's our job to be able to detect the stress and then to advise them as to how they can manage it orally.
Wow, Kristen, you're giving us some great information here. Now, you know, you started to touch on resilience, and it certainly is a current buzzword. So how does resilience and mind-body medicine work together to help reduce and control our coping strategies? How does that all work together?
Well, you know, let's face it, life isn't easy, right? No one said life was easy, actually. And life is actually pretty hard. And it's unfortunate because we have so many life events that are unpredictable and they're challenging. And sometimes those pose threats to us, right? We begin to sense a lack of control. But what is resilience, right? At its core, it's our ability to be able to adapt to stressful situations. And unfortunately, nobody really teaches us that, right? There's not really a course you take in hygiene school that says, okay, here's your coping course for the day, right? You got to learn that stuff. But really, resilience is the ability to be able to maintain healthy physiology, right? Psychological, that's included. Be able to manage that through exposure to extreme stressors. And resilience emphasizes, you know, our capacity to cope with adversity. And it includes like two dimensions. You know, we have adversities. What's the significance of adversities? But then how is it that we respond to the adversity? How can we make positive adaptations to these challenges that we have? And we know that there's some personal characteristics that are associated with being resilient to traumatic stress and being able to recover more rapidly from stress. Those kind of things are like positive emotions and being optimistic, having flexible, you know, cognitive flexibility, having emotional regulation skills, high level of perceived coping and self-efficacy, you know, strong support group. Even if you're committed to a valued cause or a purpose, that builds resilience. You know, the ability to be able to take a stressful situation and take positive meaning from it. You know, having a good support group, maybe it's with your family, maybe it's with a religious group, or even just your spirituality. But we just have to remember that, you know, our brain is an organ of predicted regulation, and it determines the way in which we're going to respond to our stress. Basically, how? Because it looks back in past memories and past experiences as to how did we manage our stress. So as a result, actually, stress can be a good thing because it can actually increase our resilience, right? Moderate intermittent stressors are a good thing. They're our teacher, right? If we can get over them, they become a positive memory so that when we incorporate, then when we get involved or are introduced to a new stressor, we can manage that, or we can know that we can manage that. However, acute uncontrollable, unpredictable stressors can be bad for us. And this is where mind-body medicine can be an effective solution for us to be able to manage our stress and to increase our coping. Mind-body medicine is the science-based research that's out there that links our thoughts, our attitudes, our emotions, our beliefs, our relationships, and all of these have a very profound effect on the physical body or our physiology, and vice versa. And it's important to know that our thoughts affect our body. If we look at mind-body medicine, and it's kind of a new area of healthcare, if you look at mind-body medicine in the overall picture and think about it as like a three-legged stool, where you look at, the surgical aspect of healthcare is one leg. The other leg may be the pharmaceutical aspect. But then the third leg is this mind-body medicine approach, because what it does is it allows us to actively participate in our own healthcare by using, mind-body tools or skills that can really empower it, and we can co-create our own wellness. Mind-body medicine helps us grow our brain back. And that's important to know that we can do that.
That's really, really interesting, just talking about, that connection between the mind and the body. And just as you're talking, I think many of us can resonate with, you were going back to kind of talking about the signs and the symptoms that we can see in our clients, like those wear facets. And I'm just wondering if there are some strategies that can help us help our clients. So something to do with that kind of mind-body connection, but as they pertain to our clients. And I also think that at this point, we might have some help with answering some of these questions if we bring on our mystery guest. So hold that question in mind, and I'm going to just bring out our mystery guest.
We do have fun.
Here she is, Jennifer Turner.
Oh, thank you for having me today.
Hi, Jen.
Hi.
Hi, Jen.
Hi, everyone. This is great. So I'm excited to be the mystery guest. I am thrilled to be one of Dr. Yont's attendees, along with Kathleen, in her program. And it was absolutely fascinating to take time for yourself and to really learn how to do things for you that really we should have been doing all our lives to manage stress, to breathe better, to get your head in a really good mindset and space. And Dr. Yont has a gift to help us to get there with poise and ease and grace. And every day I'm using different techniques from the course that just help you manage life, right? It's not always you think it's stressful, but honestly, it's really truly to manage your life. So thank you. Thank you very much.
Thanks,
Well,
Jen.
Jennifer, it was awesome to have you take the SMART program. Like, it was awesome to get to know you and connect with you. Yeah, it was. And it's really nice to see you. Thanks for joining.
Thank you.
So yeah, I guess we could talk about, here are some solutions, what are some mind-body solutions that we have? And thankfully there are solutions, right? We now have solutions, we just have to learn them. And that's really the whole premise of the SMART program being stress management and resiliency training. And there are many different approaches that we could use and learn for ourselves. But then also, once we learn these approaches for ourselves, then we can use them with our hygiene clients, right? We can give our clients tips on how they can manage maybe some stressors that they're dealing with, even if it's just in the chair. So with the SMART program, Jen, as you know, there's three essential components to it. The first one being stress awareness. Most of us, some of us, we don't even know actually that we're stressed out, right? And we actually need to become aware that how we're feeling. And that's what the stress program teaches. We teach people to pause, mindfully focus their awareness inward, and to see really how they're feeling. How is stress affecting our own body? Maybe they're getting muscle tension, right? We all do this, right? Wearing their shoulders as earrings, right? Maybe lower back or neck pain, headaches, grinding teeth. Maybe we're stress sugar eating, right? Maybe that's what our clients are doing, popping in jubes every hour and not even recognizing it, or maybe just stress biting our nails. But it's really important to become aware of how stress affects us, from different aspects, physically, emotionally, mentally, relationally, behaviorally, and spiritually. Like, are you coming home from work after a really busy day and you're lashing out on your husband? That's not a positive relational thing, right? The second component to the SMART program is adaptive strategies. And there's a couple of them here. There's 4 of them here with reappraisal and coping skills and positive psychology and social connection. But let's get into the first aspect of how do we adapt to stress. The first thing we can do is look at what we're thinking, right? Reappraise what we're thinking. This is kind of like mental hygiene. And this pulls from psychology, cognitive behavioral therapy. But it's important to know that negative thoughts and the negative thoughts that we have, and we can get rooted into these negative thought loops, right? But negative thoughts ultimately lead to negative emotions, negative behaviors, and negative relationships. And it's important to become aware of what our thoughts are. Because most of the thoughts, think about the thoughts that you have during the day, especially if you're stressed out, they're probably negative. And generally, most of the thoughts, especially women, what we have about ourselves are quite negative. And it's really important to become aware of what those thoughts are. And, we'll get into it where we talk about meditation, but that's one of the positive aspects of meditation, even as hard as it is it actually allows us when you're sitting there in silence. Because your thoughts are going to start coming when you're meditating, but then can you evaluate what are the thoughts that you're saying to yourself? So if you go to kind of coping skills, there's some buffers to stress that we can easily incorporate into our day, self-care strategies like healthy diet, sleep. Sleep is ground zero. We teach a lot about sleep hygiene. We need to get enough sleep every night. Most people need 7 to 9 hours of sleep every night. And most people need to structure and plan their sleep. It's not one of these, I'll go to bed after this movie or whatever, because it always gets delayed. We actually have to be very structured within our sleep. And exercise is quite pivotal. You don't have to go out and run a marathon, right? You don't have to be obsessive compulsive about exercise, but doing, getting the heart rate up 20 minutes, 3 times a week, getting some resistance training, building your muscles, working on your balance, working on your bone strength. That stuff is all important. But we also know that it is a buffer to stress. It allows us to be able to physiologically manage stress better. Other kind of coping skills we can look at, and even using these in the office, that will help us mitigate stress. Mindfulness, teaching mindfulness, learning mindfulness, present moment experience, right? Learning to be present in the moment and accept that moment is mindfulness. It's a moment of pause. Laughing and humor, you can bring that into the office, right? The act of laughing actually helps buffer us to stress. Science is there. Maybe we can journal. Maybe we can be more creative, going back to things you used to do as a kid, right? Doing puzzles or playing the piano or organizing your pantry at home. All of that can be quite creative. And believe it or not, when we do those things, it shifts our brain into an experiential aspect of our day. And when you shift your brain into experiencing, you actually shift it out of thinking, because that's where your brain gets in trouble, is when you're thinking. The thoughts trigger emotions and trigger the stress response. But there's other things we can learn too, is, if you have a lot of stressors, sometimes you can't problem solve all the stressors and don't have solutions for them, but we can accept the stressors, right? Sometimes we have to accept them. Sometimes we have to let them go if you can't problem solve them. So other adaptive strategies for the program, positive psychology. And yes, it is a real thing. My dad was a real positive guy. He definitely taught me positivity skills. My glass is always half full for sure. But what we now know through research is that resilience to stress and positive emotions are very closely related. And positive emotions aren't merely like a byproduct of resilience, but they serve as an important function to allow us to recover from stressful experiences. And positivity help us generate adaptive responses when it has to do with, our coping process. Learning to create positive emotions, and sometimes we actually have to fake it till we make it, right? Sometimes we have to pretend to be positive, or we have to create positive emotions within ourselves so that we can help our stress response. But when we can learn to do that in the face of adversity, we become more flexible in our thinking. When we're more resilient, we have better ability to problem solve. We have more improved self-efficacy, right? Which is our ability to know that we can actually manage the stress. It's like you telling yourself unconsciously, yeah, you got this, girl. You can do this, no problem. And also it increases our personal well-being, just being positive. So your brain approaches stressors in a very adaptive way. And it's really important to know that if we can approach a stressor from a positive adaptive perspective, your brain actually doesn't engage our stress response. That's what's really important to know. You may have you may have the stressor, the same stressor that you had yesterday that triggered off your stress response. But if you go into that same stressor with a positive attitude, positive thinking, a general emotion of, say, courage, adaptivity, knowing that you're going to learn something from this experience, your brain's not going to fire off the stress response. And I think that that's so exciting. And that's the science around that. And then lastly, we talk about social connectedness, right? We've all been locked up for 2 years. That's not super awesome for our system, right? We are mammals. We need to be connected to others. We're social beings, right? We're there to be able to be connected, be supportive, be kind to one another, looking out for one another. Because typically when we get stressed out, what do? We usually isolate ourselves, right? We usually disconnect from others, but really we need to be going towards other people. And as a dentist, right, through the pandemic, as a hygienist, right, I was so thankful to be able to go back to work before, other careers were able to get back to the office, because no matter how much PPE we had wore, we were actually in close approximation to people. We sit so close to people. That's a benefit because we sense people and our clients sense us. And we have the sensibility, we have this neuroception, right? That can be so beneficial and a mutual positive relationship between one another just to be able to sense other people. But what's important to know is how you can, without saying anything, affect someone else through neuroception. I could talk a couple hours on that actually. All right, the last thing we talk about in the SMART program, kind of one of these essential components, is the relaxation response. This is really important. I teach people how to hurry up and relax, right? We're so busy. Herbert Benson from the Benson Henry Institute at Harvard Medical School, in the very same room about 60 years ago, in the very same room where the fight or flight response was discovered, Herbert Benson actually discovered the opposite response to that. He discovered that inside of us, there's actually a natural system within our physiology that we can train to turn on that decreases our metabolism, decreases our breathing, decreases our heart rate, reduces our brain activity. And he coined this process, the physiologic response or the relaxation response, right? And the relaxation is essentially teaching us to engage our parasympathetic nervous system, which is the opposite of that sympathetic nervous system. And eliciting the relaxation response, we're going to do a little exercise soon, but eliciting that and learning to elicit that throughout our day is a skill that we can learn, which helps us grow our brain back to optimal functioning. Remember the prefrontal cortex?
So it sounds to me like you just described my life and my day, okay? From a slightful, stressful situation at work, patient, is running in late, has to go to the washroom, and you're like, oh my gosh, I've got my room only for this period of time, or my foul time, or, coming home. And I have to admit, I'm slightly honest. I do bring home sometimes a little bit of stress to my poor children and my husband at home. And I'm like, okay, I need to sit out. I need to relax. So to help my clients is important, but also I think what you're teaching me today is I need to look after me so I can help them. So what kind of tools, or Jen, maybe you can tell us how you've implemented this as well, but what are how do I do this response? How do I bring that relaxation response forward? And how can I help my clients more with it as well? Because I think this is something, self-love is not something we should put on the back burner and do it tomorrow. We should do that first and then get to our to-do list, right? That's sort of what I'm getting from here. Is that correct?
Yes, and Jen, I'm interested. Please, I want to hear your perspective.
Sure. So I think one of the greatest outcomes that I got from Dr. Yont's 8-week course is I didn't even realize what stress was in me. So we learned how to identify, and then how to identify, but how to deal with it. So it doesn't impact your family, or it doesn't impact your coworkers the next day when you go to work. And we don't want to be miserable, or we don't want to feel that knot inside. So some of the techniques are, the biggest one for me is I didn't think I was stressed. And I have a pretty crazy kind of life, but I didn't think I was stressed at all. So one, awareness. 2 is breathing. Sometimes just like taking that time to really breathe in and say something kind to yourself, and then breathe out. You feel your shoulders just, they're not up around your ears. Just relax and feel good. And so I think those are important. The other is slow down. Who can't make 30 minutes? One of our activities the 1 week was 30 minutes of, get outside, get some activity. And, we can make a million excuses. We're all busy. We're tired by the end of the day, but 30 minutes. And so one of the ladies in our program talked about being on social media for 30 minutes versus going to do something. It's how do we choose our time to take care of ourselves? And I think we can all relate to that.
Thanks, Jen. That's awesome. Now, Jen, tell me, because we're going to move into like a relaxation response exercise. And you know what, in the SMART program, we refer to it as the relaxation response. We're initiating our parasympathetic nervous system. I'm going to refer to it as, mindfulness or meditation. And that comes from my yoga background. But tell me about your experience with, because we really work on cultivating meditation, right? That is a big part of the program, where you cultivate a practice, you cultivate and you create time where you can sit with yourself. And we know that meditation, right? Meditation's hard. Sitting with yourself and your own thoughts is really hard to do. And it's a skill that you learn. And the reason why the SMART program is 8 weeks is because we know through neuroscience that if you can cultivate a meditation practice, and gosh almighty, it doesn't have to be 20 minutes a day. It can be 2 minutes a day, 1 minute, twice a day. But if you can begin to cultivate a meditation practice, where and meditation is really the act of being able to, you're learning to engage different networks within the brain, bing, 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 which exist here in your prefrontal cortex. They're experiential networks. And so when you can teach yourself to engage experiential networks within your brain, we know that that takes time to do. Right? That's the reason it's an 8-week program. Is 8 weeks, it takes time to grow those attentional networks within the brain, the experiential networks within the brain. But usually by the end of the 8 weeks, you actually have created some neuroplasticity where you can go into your mindfulness practice, meditation practice, and start to feel good about it. And I want to hear your perspective on that.
Yes, thank you. So part of it is the 8 weeks also really helped formulate habits, because you think you're busy, you don't have time. And then, we know we're coming to the group, and we had amazing exercises to do. And I'm going to admit to you ladies and everyone here, I wasn't really sure what meditation was. And like, why? Because we can sit there and be quiet, but I don't know about you guys. Are you thinking about your grocery list, what you're going to do this weekend, a patient that maybe you forgot to chart something in their notes that you need to make sure you do tomorrow? So it really helped me to it was the first time in my life I ever meditated and realized what it was and how good it felt. And how often do you actually clear your mind? Not very often. That was the first time in my life, the first time it worked for me. And Dr. Yont's voice and clarity and leadership on this, it just puts you in such a wonderful, wonderful place. So 8 weeks, I loved every minute of it because we learned so much about ourselves. And one great part was there was an opportunity for other participants in our group to share some stories. And so you learned maybe what was working for them or what wasn't working, and you could relate. And the conversation was so useful and grateful. And it really is that saying of, when you're on a flight, I flew home last night, put your mask on first before you put others. Because if we don't stop and take care of us, it's really difficult. So I am a huge believer in Dr. Yont's program and what she offers and how it's impacted my life. And I wasn't sure when we started exactly what was going to happen. And the transformation for me was so valuable. So I can't thank you enough.
Oh, hey, thanks, Jen, for that feedback. Yeah, meditation is hard. It's probably one of the most difficult things that you can teach yourself to do. And that, like you said, it's because your mind, hey, our brain is designed to think. We're thinking about the future. We're thinking about the past, right? But really where joy and wellness and all these great feelings come into play is actually when you can teach yourself to be present. There's a shift that happens in your brain from when you're thinking about the future, all of a sudden you think about the present moment experience, your brain shifts and you develop these networks, which are growing areas where it allows you to it helps you feel better, right? And from a perspective of stress, you're actually growing the networks, which help mitigate the stress response. But what's important to know too is that if you're just starting to meditate, go slow, right? Do not start with, we all like to have goals. There shouldn't really be any goals around meditation. I try not to tell the people you need to be meditating 20 minutes a day by the end of the program. No, you want to start slow. Like I said, maybe a minute a day. What I like to do is I like to bookend my day. I think this is really important for healthcare professionals, is bookend your day. RPM, David G talks about that. RPM, rise, pee, meditate. Rise, go to the bathroom and sit. And maybe it's just for a minute, right? Where you just sit and you breathe. And then you go out among your day. And then you have a really stressful day, right? Like we all do, right? And then you get home from work. And the very first thing that I do when I actually walk through the door, and Darren knows this too, is Darren just says to me, okay, let's go meditate. We both do it together. It's so lovely that I have a husband that actually meditates with me. And we meditate in different ways. But as soon as I get home from work, I go and I sit on my meditation mat, and forever how long I sit there for. And it makes such a difference because it clears my mind so that I can open up these endless possibilities for my evening to be able to spend this great time with my husband where I'm not thinking about work. So I recommend always bookending your day, not setting goals. A lot of the research that's done around meditation is 40 minutes a day. That's a lot. However, at this point in time, and I've been meditating for 12 years, where I bookend my day with 20 minutes in the morning, 20 minutes after work, and I have to carve that out of my day. I make that priority. Meditation is dose dependent. That's not going to happen all at the same time. Remember, you got to grow the brain that you use. Now, when I wake up in the morning, I can't wait to meditate. 10 years ago, I'd be like, oh, I don't want to do this. This is so hard. But you get to you grow the brain you want to use.
And I just want to share that I used to think maybe I meditated before I did this course. So I would have be in the shower, right? You're washing your hair and you're thinking, you're saying nice things, you're being positive about what's going to happen, until I actually went through the program and learned. It's not while you're putting dishes away. It's not, shoveling snow or something like that. You really have to take that time for you. And one of my questions would be, I'm usually exhausted after I meditate. Is that normal?
That's interesting. You know, everybody is a little bit different. And you know what, Jen, I think that'll change. And I think that depends on what kind of day you've had. People ask me that question a lot, you know, how do I meditate? Should I lie down? Should I sit up? And I always say, because when you start, you know, you want to be comfortable. And for some people, that's lying down. But you also don't want to get to a position where you meditate and you fall asleep, because we're all busy and we all basically lack a lot of sleep. So when you're in your meditation, yeah, you know, maybe you've had a really tough day, or maybe it's like when you first start, it's hard to meditate. It's hard to focus on your breath, focus on something, right? You have this object of awareness you're focusing on. Focus, focus, focus. And we're going to do this pretty soon, right? Focus, focus, focus. And then all of a sudden your mind drifts away. And then you have to use energy to be aware of where your mind drifts. Notice that. But then you use energy in your brain to pull your attention back to the object of awareness. And it's a constant process of, where does your mind go? Pulling it back. Where does your mind go?
So true.
That's exhausting.
Yeah.
And sometimes after a hard day, if your mind's going to, I should have done this, I'm terrible, I was a loser at that, which is a lot of the time what we're saying to ourselves, just going back into that is exhausting, right?
Yeah.
Anyway, all right, let's try this. Let's initiate the relaxation response. Let's do a short meditation, just so that we can get a little bit of experience in this area. And remember, like I said, meditation is really quite simple, but it's very interestingly hard to do. There's 2 steps to meditation. The first step is repeat a word, sound, phrase, prayer, or movement. Second step, passively set aside intruding thoughts that are going to come and return back to the repetition. Easy, right? Okay, so let's try doing this. What are we going to focus on? Well, the easiest thing that anyone can focus on or have as their object of awareness is actually your breath, right? Your breath. Think about it. It's available to everyone. You know, the breath doesn't discriminate, right? It doesn't discriminate against sex, culture, religion, social status, how many Facebook likes that you have, right? The breath is available at any time, and it's available anywhere. You could do it at the bus stop, in the lineup at the grocery store, at a stoplight, right? You always have it available to us. So a lot of the time we use our breath, because there's a lot of things about the breath that you can focus on. You can focus on how it feels within the body. You can focus how it sounds, right? Or you can just maybe even just focus on the sensation of it coming back through the throat or through the nostrils. So there's a lot that we can tune into with the breath. So let's try this all together. When I do direct, or when we start to meditate, the first thing that we want to do is to be comfortable. So let's all sit. We'll all sit. We'll all be comfortable. You know, we want to have an erect spine, right? We want to use our spine to be supportive of us. Maybe our feet are contacting the floor. And the next thing you might want to do is just close your eyes. And what that does is it kind of eliminates the outer distractions that we have. So feel free to close your eyes. Now, if closing your eyes doesn't work for you, because sometimes when we close our eyes, it can bring up inner sensations or visceral feelings that we don't like, then keep your eyes open, but just focus on something. You know, if you're in front of a window, maybe focus beyond the window to the leaves of a tree or the bricks of a building. We just want you to get to a place where you're focused. And then just bring your awareness to your breath. And so with this breath meditation, I want to teach you to do what's called diaphragmatic breathing or belly breathing. You've probably heard about that. So belly breathing is actually just feeling the breath rise and fall within the belly. When we're belly breathing, we're actually using the diaphragm for what it's meant and intended for. So when you inhale, the diaphragm is going to drop down and it's going to allow the belly to expand. So bring your attention there. And then on your exhale, notice the belly drop as the breath descends back through the lungs, through the throat, through the nose. Just keep focusing your awareness on the rise and fall of the breath through the expansion and de-expansion of the breath through the belly. Now, if you're sitting and you have a hard time tuning into this belly breath, sometimes it's more advantageous to lay down, where you put one hand on your belly, one hand on your heart. If you're sitting in an office chair and you can't feel your belly rise and fall, maybe you're so used to, shallow, short breathing within the chest. What you can do is just, flex from the hips. You can put your forearms on your thighs and you can fold over. And maybe in that position, you can feel the rise and fall of your belly. So as you continue with your own belly meditation, your breath meditation, I just want you to know that just by engaging your diaphragm, the muscle fibers, the fascia of our diaphragm is connected to every single strand of fascia throughout the body. And as the diaphragm contracts or expands or moves, it actually initiates a calming or a relaxation process throughout the body. Like diaphragmatic breathing stretches muscle fibers and it signals relaxation throughout the body and the mind. Maybe you feel it now. Diaphragmatic breathing releases tension. It deepens our relaxation because it initiates that parasympathetic nervous system. It increases clarity of mind. With practice, increases concentration and focus. We have better oxygen saturation, efficiency, really, to our peripheral cells through this belly breathing. Here's a big one. It supports our sleep, supports general good health. So now we'll switch this meditation. We're going to bring our awareness not only on our breath, but we're going to bring our awareness to a phrase. And on your next inhale, I want you to say to yourself, I inhale calm. And on your exhale, I exhale peace. I inhale calm. And I exhale peace. Maybe when you inhale, you just say the word calm. And exhale, sing the word only peace. Remember, meditation allows for a network shift, right? You're an experiential awareness. Experiencing is different from thinking. You're growing experiential networks. You're growing the executive aspects of our brain. And so just coming out of this meditation, just take a moment to, keeping your eyes closed, just notice, that you're back in the room, kind of notice your presence, maybe sounds around you. Just take one final breath before you open your eyes. And as you open your eyes, just notice how you feel. Thanks, guys, for joining. Little meditation.
Thank you, Kristen. It was awesome. It's your voice too. I love hearing you speak.
Thanks.
I know we're getting close to 1 o'clock, so I just wanted to say, like, one of the things that I loved about the SMART program when I took that with you was the appreciations and the gratitude practice. So I was hoping you could just share a little bit of the science as to why cultivating gratitude is a helpful practice, And then how can we use that with our hygiene clients?
Awesome. I love the gratitude appreciation practice as well. Thanks, Kathleen. And we really focus on this within the SMART program, where we try and generate or try and develop or try and cultivate an appreciation or gratitude practice. It's kind of like a buzzword right now, having a gratitude practice, or I have a gratitude journal, right? But what's important to know is if we can practice gratitude or appreciations, we basically change the filter in which you see the world. We've all come out of a very stressful time, a very stressful 2 years. What's important to know is when we're stressed out, we generally have negative, unconscious, automatic thoughts. And when we have negative, unconscious, automatic thoughts, unconsciously, that drives negative moods, negative feelings, negative behaviors, attitudes, and beliefs. And we have to pull ourselves out of that, right? We have to get out of this negativity loop. And we can do that by practicing appreciation, because it allows us to become aware of our everyday pleasant moments. Life is fantastic, guys. We're so blessed to live in the lives that we live in. And there is so much good around us, but we have to teach ourselves to tune in, to the positive moments, to the positive sights, smells, sounds, emotions, and physical sensations that we actually have, rather than the negative ones. Your brain only has so much power to focus its attention on, and it can't focus on negativity and positivity at the same time. But if we can practice appreciations, it encourages us to pause, kind of shift our attention, right? And take notice of all the pleasures that we actually have. When we practice gratitude, right? Different areas of our brain light up, right? Parts of our brain that direct attention, parts of the brain that change our mental filter into what's really relevant to our life in this moment in time. And I think this is awesome that when you practice appreciation, being appreciative actually overrides that threat system in the limbic system, that amygdala that we talked about, that fear center. And gratitude stimulates our hypothalamus to help us mitigate our stress response and regulate our anxiety. Here's key. Once we start seeing things to be grateful for, the brain starts looking for things to be grateful for. And I've personally experienced that in my own day. I walk to work every day. I used to just walk to work, thinking about work. What's going to happen when I get there, right? Mm-hmm. Now I walk to work, same pace. I get the same benefits out of walking. But now, yesterday, I appreciate the lilacs, right? The lilacs are out. I love the white ones, but purple's my favorite color. I appreciate the purple ones. I appreciate standing under a lilac bush and just smelling. People on the street passing by, they must just think, who's this loser over here that's sitting there smelling the lilacs? I walk by a school when I go to work. The kids are playing. I'm not a big kid person, especially young kids, but listening to kids play, right? Laugh. It's just so joyous, right? Thinking about work, thinking about the positivity of work. And that's how I incorporate my appreciation practice. And with the program, we teach people to, before you go to bed at night, have your own appreciation practice where you take a minute before you go to sleep and you recapitulate your day and you pick the 3 things that you appreciated. 20 minutes, all you need to do. What did I appreciate today? Well, maybe today it was that first cup of coffee you had, right? Go back into your mind. Picture yourself with that cup of coffee, holding the cup. It's warm, it's there, smelling the coffee, putting it to your lips, tasting the coffee. Go back into your mind, because your brain doesn't know if it's actually happening now. If it happened, the same chemicals are responding. Those positive, appreciative chemicals are responding, right? And you pick 3 things throughout your day that you really appreciate. And then you go to bed on that, because the networks that you fall asleep on are the networks that your brain functions throughout the night. And that's really important. We want to set ourselves up for a good sleep. So I don't know if we have time. You guys let me know, but maybe Kathleen, you could just tell me, as we do in the SMART program, tell me what you appreciate today.
Well, I appreciate all of you. That's how I'm just so thankful. I could get emotional right now. I'm just so thankful for you guys all being here and for what we get to do and all of our beautiful members. And yeah, what I'm grateful for. Thank you.
Thanks, Kathleen. Well,
I am grateful that you came to enlighten us today, because it's something that we all need to take serious note of and move ourselves forward in that area, because living our better life is what we want, and that will allow us to look after so many others in our lives so much better. So thank you.
I personally am very grateful for reducing the guilt of taking some time for myself. As a busy mom of like in between age children, it's hard sometimes to balance it all, and everybody has a different life balance. Everyone has a different, section. But for me, it's taking time to not feel guilty about taking just a few minutes to my day just for mom time. And I think that that's what I need to take away from this, and to remember to breathe. Just breathe in and breathe out peace. So that's my takeaway.
Beautiful. My takeaway is just being a rather high-strung individual. Just a reminder that it doesn't have to be something even overly complicated. Like what you were talking about with the coffee just at the end there resonates with me so much. Just, it doesn't have to be a huge step, just a step in the right direction. So thank you.
thank you. Thanks, you guys. I really appreciate you having me. It's just such a joy to be able to connect with you all and to spread a little stress management, right? Thank you.
So thank you so much. Oh, sorry. I was just going to say that some people want to get in touch with you. So what I'll do is we're going to put together the follow-up email for those of you who weren't on at the beginning. If you're watching us through Facebook, please email info@rdhu.ca, and we'll connect you with getting your own personal portal, get your certificate in there, the short quiz. And then for everybody else who is on Zoom, we will send a follow-up email. You'll get your access to it takes a while, like for everything to process. So probably by Monday, you'll have it all. And then the follow-up email to connect you with Dr. Yont, with Kristen. And again, thank you so much to Kristen Yonde for sponsoring today. And I know Robin Shields is on today, and she's very, wonderful for all of us and always supporting dental hygienists. And so thank you, Robin, for being on here today as well.
Jen, we also love that you are a mystery guest. Thank you for staying behind the scenes. I know you've got to go, so we appreciate that. And 123 Dennis says, I understand Dr. Yont and Jen, you guys kind of ironically work together with 123, so that's awesome. So Jen, if you've got to exit, go ahead. Just to conclude, as Kath already went over the CE, if you are looking for additional resources or ways to reduce some of your stress with CE stuff, Kath, what do we have? We've got a new launch coming out in next week, right? With DH?
Oh yeah, we do. We have we're doing this summer Learn and Save, and that is the Dental Hygiene Quarterly. We used to do this very often, but then once COVID hit, we did the relief program instead. And so now we're going back to the Summer Learn and Save, where you get 3 years of CE, so you don't have to go looking for it because that's stressful. And it's created by RDHUs, so it's created by dental hygienists who are, a lot of us are experts in the field. And so it's just a really great platform. So 3 years, you have 3 months to purchase it, June, July, August, and for $333. So basically it's $111 a year. If you're a CDHA member, it's a CDHA membership benefit. But if you're a non-CDHA member, you're still saving, and we'll put the email out. So once you're connected with RDHU, if you're on Facebook right now, you can go to rdhu.ca and opt in, and we'll be sharing all that on Monday. Yeah.
And this was such a powerful course. I can't write or express to you the thankfulness of all the people that have joined us. The comments are out of this world. So please remember, this is recorded. So please share this information with all of your other colleagues. It will be on the RDH View tab on the RDH website in the next few days. So please do look for that recording or watch it again on Facebook. But this was honestly so amazing. You, Kristen, are an amazing individual, and we really appreciate you scheduling us into your day with how busy you are. And again, thanks to Kristen Yonde.
Yes, thank you so much.
Thank you.
Have a great day, everybody.
Be well.
Have a great weekend.
Yes, be well. Have a wonderful summer. Our next RDH won't be until September. So enjoy your time off, rewatch the episodes, definitely sign up for DHQ. And we look forward to seeing you guys all in September.
Thanks.
Bye.
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 Bye.